Today we're speaking with Cynthia Ryan, Associate Professor of English at the University of Alabama at Birmingham and CR Magazine contributing writer. Thank you for joining us.
Thank you.
1 year ago, you started reporting Homeless with Cancer for the fall 2010 issue of CR Magazine, intending it to be a straightforward report about the underreported healthcare needs of the homeless cancer patients. But as a 17-year breast cancer survivor yourself, the story of this invisible community, as you call it, became personal, and you developed very close relationships with some of the survivors in the story, especially Edwina Sanders, a stage 4 breast cancer patient. So what are some of the biggest healthcare and everyday challenges faced by the homeless survivors you met while reporting this story? And how do these challenges that the survivors face compare with your experience when you were in treatment for breast cancer?
That's such a huge question, and it's very complex. I think that some of the things that they encounter are things that I expected. Obviously, they don't have a place to lay their heads at night. They don't have access to the same kinds of food that we have. But I think the thing that came out of this experience with the homeless that surprised me is that I assumed I would go into it and I would be the helpmate. I would meet these people and I would say, oh, what can I do to help you? And, I have a wealth of experiences. And it really was the other way around. Because people who are homeless with cancer, especially those who were homeless before they were diagnosed, they've already been living one day at a time. And they have a vast range of issues and problems and struggles. So in some ways, when they come across cancer, I don't want to say it's a piece of cake, but they have strategies and tactics that a lot of the rest of us simply don't have. So I think that they do have challenges beyond just the effects of the cancer. They have to worry about things, whereas we're concerned when we're diagnosed with eating the right foods or making sure we make our appointments and do what the doctor says. A lot of people like Edwina struggle simply to find a way to get to the appointment and a way to get home after chemotherapy. She's currently living with her sister on the floor, and there's no electricity, and it's a long way. And public transportation is not great in Birmingham, Alabama. So it's really too complex of a question to answer. It's just huge.
What is your relationship now with the survivors in your story?
It's varied. I'm still very close with Edwina, and I go to appointments with her, and especially when it's someone like a doctor at the pain clinic, and she feels that she needs someone to come along to vouch for her because she has had some troubles with drug addiction in the past. I'm also fairly close with Lisa Brown, who is another breast cancer survivor. I see them occasionally at Church of the Reconciler, where I go on occasion. That's where I first met them all. Some of the people have kind of vanished for different reasons. 3 of the men that I interviewed all have some form of mental illness. One is paranoid schizophrenic, and when I go to his sort of rundown row house to visit him, you don't actually know if he's going to open the door because he hears voices and you're just not sure if he knows who you are. Another man, Roderick, has stage 4 colon cancer, and he actually is in his final days and has retreated back to the street. He's under a bridge and has pretty much cut off any kind of communication. Another man, Charles, I'll see occasionally, but I would say that Edwina and Lisa, and particularly Edwina, are still very much in my life, and it's almost hard to remember what it was like before Edwina called me every day on my office phone. So we're pretty tight, I would say.
How did reporting and writing this story over the last year and developing these personal relationships with the people you were interviewing change your perspective as a cancer survivor?
It took me down a few notches. It's sort of like I was saying before, you go into these communities assuming that you're going to lift these people up, you're going to help them, and what you find in return is that they give a lot back to you. I guess that it's so easy to simplify cancer, and it's so easy to simplify homelessness, at least from a popular perspective. I know that certainly scientific researchers know that cancer is not a simple thing. But what I learned by going into this community is that homeless people with cancer have as rich and varied experiences with the disease as anybody else. And in some ways, and I struggled with this in the article, in some ways I found that my experiences very much resonated with theirs. I could be in a room with someone whose life couldn't be more different than mine. I mean, I'm educated, I came from a very stable home, I'm financially secure, or as secure as anyone can be right now. And many of these people don't have an education, have very meager, if any, reading and writing skills. They, for the most part, have inferior treatment or simply didn't get diagnosed until they were fairly late stage cancer survivors. And I think that what I've realized is that cancer is so much more diverse than we have any idea it is. I mean, we think when we're at a conference like this, we think we understand what cancer health disparity is. And I don't think we're even on the cusp of understanding what it's like for somebody who doesn't know if she'll be able to even make it to her appointment to see if the cancer has spread. And so it took me down a few notches. I mean, I would say that I thought I knew everything about cancer, and after my experience with them, I think I know very little, actually. I know a very narrow experience. And they showed me that there's a lot more to it. So.
Why did you immerse yourself in the story to the extent that you did? A lot of reporters would spend a day or two interviewing people and then write their story, but what compelled you to keep coming back?
Well, in all honesty, one thing that kept me coming back is that I do have the luxury to be able to spend time with them. I am not a full-time reporter. I'm an English professor. So I write kind of on the side. And I did go into it thinking, wow, this will be a great story. I'll write it up. Maybe it'll take a few months and then I'll be done with it. But the only response I can give to that is it's the right thing to do. You don't go into a community like this and get these people's stories and say, oh, we're going to try to bring attention to this issue and then leave them in the lurch. I mean, it's just not the right thing to do. And as a professor, I constantly teach my students about the ethics of authorship, and you have to be humane, and you have to go into a situation not just looking for what you can get out of it, but what you can give back in return. And I'm sure that what I'll give back to them is minimal, very minimal. But I can't leave them behind. They're 12 blocks from where I teach every day. And I can't just ignore them and pretend that Edwina's not there and that she's not suffering when I can go home and eat anything I want to eat and know that I'm going to be warm at night. And I can't do that. It's wrong. I just went to a session, and I think the speaker's name was Dr. Carr, and she was making a comment about how in the history of anthropology there's been a real tendency for what she called helicopter researchers, which I'd never heard. I've always heard of helicopter parenting. But these people who kind of hover over a community and drop in and get their stuff, and then they leave everything the way it was. And I sort of laughed because I think that's what I was going to do. And I can't get rid of these people even if I wanted to. I mean, they're in my life. I see them, they call me, we catch up. I go to appointments with them. They're a part of my life now.
The survivors in your story clearly have many unmet health needs and also basic everyday needs. How were you able to help them, and how were you limited in what you could do? So what kinds of support did you offer, and did you think that you had sort of to draw a line about what you could and couldn't do to help?
Yeah, that's an ongoing struggle. And what I've done is a drop in the bucket, and therein lies the problem. I mean, what these people need And not just these people, but people in a lot of situations where they don't have the same access to cancer diagnosis and treatment and information. What they need is systematic change, and it's nowhere on the horizon. One thing I learned, and I guess I knew this to some degree, but when it's facing you, it's a much harsher reality, is that a lot of these people, they aren't eligible for the kinds of services that exist. For example, many of these people have mental illness, serious mental illness. And recently in Birmingham, there was a grant awarded to one of the institutions within the city, and it's for individuals who are homeless who recently got out of prison. And so it's to help them kind of get back on their feet and to start anew. Well, the problem with that is that if you haven't been to prison but you're homeless, you're sort of punished by the system. So what they need is systematic change, where there's more opportunity for help regardless of how you're identified, either by your own self-identity or someone else's identifying of you. In terms of what I did, I was able to get some supplies, colostomy supplies for some of the men. One of the biggest things they struggle with is that they don't have enough colostomy bags to get through a month. And so I kind of called people I knew in the medical community and got some supplies for them. I buy food occasionally for some of them. One of the greatest needs that Edwina has, I don't know if it's a need, it's more of a desire. She likes red grapes, and her doctor told her to eat red grapes, but red grapes are expensive, and she also can't go to a grocery store because she doesn't have any way to get around. So if you want to make Edwina happy, you go buy a bunch of red grapes and you give them to her, and she's thrilled. So little things like that, taking them back and forth to doctor's appointments, going with them to the doctor. I've been in situations with Edwina in particular where a physician will walk into a room and not really speak directly to her. But if I chime in and say, oh, I'm Cynthia Ryan and I'm a professor of English at the university here, all of a sudden they're very chatty. And there's something really wrong with that. Edwina is a human being. And sometimes I think these folks need someone to give them a voice, not because they don't have anything to say. They have a lot to say, but we don't want to hear it. We want to simplify where they're on the street, and we want to simplify their circumstances and believe that they have the same access to care that we do. And they don't, period.
The cancer survivors in your story all arrived at homelessness for different reasons, and they're all, as you say, from different backgrounds. What do you want CR readers to learn about this community of survivors from reading your story in the fall issue?
We cannot, in good conscience, wear our pink ribbons and our yellow ribbons, and I don't know what other colors we have now, and say that we're activists and we're all for preventing and early awareness and curing cancer if we look past and step over people who are homeless. And I did it too. I'm here to say that I did it too, and I'm ashamed of myself. When I look at these people now, I think, what the hell have I been whining about for 17 years? I have the best of everything. I had a good life before cancer, and when I got cancer, I had the best that there was. I could afford it, and I knew how to navigate the system. And if we really care about the cause, we'll stop being so cheery about it, and we'll go out and we'll try to reach some of these communities where people are living like they're in the third world. I just came back from Zambia this past summer, and the experiences of the women that I saw in Zambia who are dying primarily of cervical cancer in that instance, many of them are in the same circumstances that people like Edwina are in. Edwina had a tumor for 6 years before she went to the doctor because she didn't think she had the ability to be treated, to be seen. She didn't know what was happening. No one around her was informed enough to tell her that there was a problem. So, we need to take action. We need to not be helicopter researchers, I think.
How can others reach out to help this community and make a difference in improving the health care of the homeless?
I think in terms of policy, it's very important to lobby our local politicians and our healthcare institutions to set up respite centers for people who are homeless, who need longer term care. There's a guy in the community who, this is one of the saddest stories I've ever heard, and it happened before I knew him. He went in for chemotherapy, came out, slept on the street. It was a cold winter in Birmingham, and his stent got infected. And he went through a horrible ordeal. So there need to be places that are safe, and there certainly isn't room in most shelters in most places in the U.S. Certainly not if you have this additional layer of health issues. But we need to do that, and I think just on a practical level, donating unused supplies. Edwina can't afford a prosthesis. She doesn't have insurance to have reconstructive surgery, so she was put on a list for a used prosthesis. Buying them groceries, giving them money for transportation, going through an institution that you trust to get those things to them if you fork over the money. So, and I think also just being open to their stories and not believing, like I did, that you're going in to swoop them up and to save them. They might be saving you, actually. And that is certainly what Edwina has done for me.
Cynthia, thank you so much for joining us.
Thank you.